Okay, hi everyone. Welcome back to another shadowing session with Fresh Dental Shadowing. Today we have Dr. Stephen Liu, and he's a general dentist. So take it away whenever you're ready, doctor.
All right. Thanks for hosting, guys. All right, let's start off. All right, so I am Stephen Liu. I graduated from University of Michigan in 2020. So I'm a recent graduate, and now I'm working in Fresno County at a federally qualified health center. So I'm going to talk all about that in a bit, and I'm going to run through by talking about how I chose dentistry, my education and what I did during my application cycle, why University of Michigan, how it was transitioning from dental school to practice, what a federally qualified health center is, dentistry's role in medicine, and I'm gonna go through a couple case studies and then I'll end with Q&A. All right, so there's the table of contents that I just listed off. All right, so choosing dentistry. When I was in college, I knew I wanted to be in the medical field of some sort and be some type of provider. Um, I never really thought about dentistry, but I was kind of pushed to it from my parents, saying that dentists make a lot of money. And I didn't think of it as a career because I didn't want to do a career for the money. So I didn't really think about it until I went to college. Um, it wasn't until second year when I thought about careers, and I joined the Predental Society. And the first meeting there, they had me doing PAT puzzles from the DAT. And I remember thinking it was super cool because I was like, okay, cool. Like dentists get tested on, puzzles and being able to visually understand everything. I thought that was cool. So I did some more volunteering with the club, and I did this event, which really made me choose dentistry. It was called CDA Cares, California Dental Association Cares in San Jose. And I remember driving up with my club members, and the first thing I thought was, dang, there's a crazy, crazy line outside of the convention center. And, San Jose Convention Center is huge because it's usually held for Comic-Con and really big events. So when you walk in that tent over there, it's all packed. And outside the tent, there were people lining up, and it was like Black Friday, but for dentistry. So at CDA Cares, people get free dental treatment for the uninsured patients, or if you have a dental home, but I guess you can't be put in right away, they come here. So it made me think of dentistry in a different way, because a lot of people, when they think about dentistry, me included as a pre-dental student, I just thought, dentists, they clean your teeth, they do fillings, and they live a nice posh life. And it wasn't until I went here and realized that, holy crap, there's a lot of people that need dental care. And when I was here, I just felt so motivated from everybody giving dental treatment. Everybody is so caring and had one goal to help people and doing it for free. And I just knew that this was something I could do for the rest of my life. And about dentistry, I love the hands-on aspect of it. I grew up liking to draw. I played a lot of video games, so I really like the visual and hands-on aspect of it and building things. I liked playing with Legos. I liked making baskets, just using my hands in general. So that's how I chose dentistry. So I went to University of Michigan School of Dentistry, class of 2020, like I said. Um, in undergrad, I went to University of California, Santa Cruz, graduated in 2015. And I went to University of Medicine and Dentistry in New Jersey for a master's. Actually, was watching your previous video of Dr. Ruby, and she did that too. A lot of people actually go to that master's program, and people are very, very successful that go there. I'm going to talk a little bit more about it because I actually have a different route than most people that do choose master's program. So I'm going to talk a little bit about that too. And then pictured down on the left, that's me as a predental student being so excited and filling my first tooth. And now I do these all day. And then there's me on my first day of orientation, and I was so freaking excited. And there's me on the right, um, graduated as a dentist. So it's crazy. All right. So my dental school application cycle. Let's talk about everything here. So, oh yeah, about the master's program. I actually applied to dental school and master's at the same time in 2015 because you have a gap year until you start. And one, my parents were forcing me to, and they said well, they paid for it. So I was like, I don't need a master's program because my GPA was 3.55 and I didn't need it. So I was thinking, fine, it doesn't hurt, right, to do a master's program and be in school. But it turned out to be pretty freaking hard. So it gave me the run for my money. And another thing why I chose it, because, okay, so immigrant parents, first generation parents, if I go hang out with my friends while I'm interviewing for dental school, I'm going to come back home. And then if I don't get into dental school, they're just going to blame it on me hanging out with my friend on that one day. And I did not want to deal with that during my interview cycle at all. So I was like, let me just go to school. I mean, you said you're paying for it. So I did it. And then, yeah, it turned out to be way harder than I thought it would be. So I would interview during the master's program towards fall, and I'll be flying out during the weekends, and I think I'll come back and study for my master's exams. And then the third bullet point, I was actually accepted from my undergrad GPA because I never sent my master's GPA to dental school, is because I got the notifications in December. So they didn't even see my first semester grades at all. So I was like, crap, kind of like a waste of money. Because master's is really expensive. It's $30K. So I recommend people to do it if they have 3.0 GPA or under, because you will prove to the admissions people that you can handle the workload of a master's program. Because at Rutgers, you have the choice to take dental school courses with dental students and medical school courses with medical students. I highly advise against that. A lot of my classmates did, and they would just tank their GPA, because the whole point of you doing a master's program is so you can have a higher GPA, not so you can tank your GPA. There's a reason why you went to a master's program in the first place, is because you didn't get your study habits down. So if you're doing this master's program, you're jumping right into literally with your dental classmates. Dental school is way harder than master's. So yeah, it's not going to end up well. So you want the highest GPA you can. Yeah, so I got 3.95 GPA, and I have a study technique that I will tell you guys at the end of the presentation. It's a grind, man. It's a grind as a pre-dental student. It's all about studying. It's really different as a dental student and as a dentist, because there's a lot of things you don't even use. It's like the proving grounds when you're a pre-dental student. So I had 13 interviews, 11 pre-December, and then 2 post-December, which I didn't go to. So I got accepted at 7 schools and waitlisted to 4. I was surprised I got accepted at University of Michigan. I was waitlisted actually to, I guess you would say, like the easier schools to get into, but it's all like sometimes it's luck. So bottom left is my acceptance letter, and they didn't send me that sweater. I just bought it myself, but made it look like I did. But in my emails, you can see there are all my interview invitations. Well, some of them, and by the top, it's the acceptances from December 1st. So, man, I can't even begin to tell you how happy I was on that day that I got these emails, got the calls, and knew I was going to be a dentist one day. And it was the best day of my life. Being a dentist though is a different story. So I'll get into that. All right. So why did I choose University of Michigan? I was actually choosing between University of Michigan and UOP, University of Pacific, which is the only 3-year program in the country. I wanted to go there when I set foot on the campus, and I was like, damn, I need to go to UOP. This place is amazing. As a California resident, a lot of dentists graduate from UOP. So there's a big reputation here in California. So I was like, that's my goal. I mean, I got in, but then when I visited the University of Michigan, I got exposed to the potential curriculum and the experiences I would get. And I didn't think I would be making this choice, choosing University of Michigan, but it was a great choice I made. And the reason being is because University of Michigan is a very well-known school in the world. And I didn't even know that, because also people in California tend to be in a bubble. We just think like California's the best, California's the best. But that's not necessarily true. So I liked being able to get out of California, to New Jersey at Rutgers, and to go to University of Michigan. It was a great experience. I learned a lot of great skills in general dentistry, in clinical, and also at University of Michigan, a lot of people specialize as well. So I'd say 50-50 people specialize and people go into general dentistry. Yeah, it's pretty diverse, but usually at the big name schools like University of Michigan, Columbia, Harvard, people tend to specialize. That's just the nature of their culture. They kind of push their students to do that. The nice thing about University of Michigan and a lot of other dental schools is that there's a rotation program where you basically go to community health centers, like where I work now, and then you are practically a real dentist. Instead of getting multiple checks like you do in dental school, of like, okay, here's my patient, this is their health history, can I start? Okay, this is what I'm doing. This is my plan. Okay, can you check the tooth once I cut it? And then, okay, can you check the tooth once I fill it? And then can you check them out? Can you sign my papers? In your external rotation, you're just going from, all right, here's my patient, and then they check you at the very end. So you're basically problem solving the entire way through. That you don't realize that you had this handicap while you're in dental school. So that gives you a lot of real world experience and confidence that you need to be successful as a dentist and a healthcare provider, and basically you're a doctor as well. So you have to know all these things, and the external rotations give you this experience. At University of Michigan, we have a pathways and immersions curriculum. Actually, I think they're the same thing now. Immersions there's 2 pathways. So there's selectives and then there's immersions. Selectives is basically different classes you can take. It could be clinical, it could be extra didactic courses in a whole broad spectrum of classes. Like there's a checklist one. I don't know if you guys have read the book about Checklist Manifesto. It's about creating checklists so you don't mess up each step of the way. There's another one about meditation. And then the one I did was the oral surgery selective course. The immersions pathway, the other branch of it, is basically you can do literally whatever you want as long as you find a faculty mentor. Like you can go to a private office and start doing research there, or even do clinical dentistry or something. As long as you have an idea and a faculty member, you can do whatever you want. And there's a lot of faculty members that are really passionate about what they do, and increasingly building a more repertoire of faculty that really want to do these things. So there's a lot of opportunity if you want to pursue that. I was already burnt out from D1 years, so I don't want to go do anything extra. So I chose to do oral surgery selective course, which you apply to after your D3 rotation. So I became really interested in oral surgery. So I got a lot more training in that. I got to do really invasive surgery where you cut open the gums, shave bone down, do it in dental school. You do it at an oral surgeon's private practice. So it's great experience. And lastly, University of Michigan has a huge reputation in the world, and there's a huge alumni network, not just with the dental school, but because you're on the undergrad campus and grad campus, because there's multiple grad schools at University of Michigan. You get to network, make friends with all types of people. So it's a great campus to be on, and it's unlike the experiences I had in undergrad and masters. It was a great experience. All right, let's talk about the transition from dental school to practice. So in dental school, you usually see 2 patients a day for most dental schools, one in the afternoon, one in the morning for 3 hours, one in the afternoon for 3 hours, sometimes even 4 hours. And now you go into a private practice or corporate or federally qualified health center, then you see 10 to 20 patients. I see on the higher end of patients, and it's pretty crazy. I'm actually burnt out right now for the past week and a half because we had 6 dentists, now we're down to 3. So I see a bunch of emergency patients. Any empty slot, it's filled in with an emergency patient. So that's not my column. I mean, that's not my patient list, but that's essentially what it looks like. I have 3 columns. So one column is restorative and operative. So if you're doing crowns, you're doing fillings, extractions, that's one column. Another column is exams. And then the other column is cleanings and dentures and stuff. So I'm constantly bouncing from one patient to another. So in a 30-minute span, I can have 4 patients sitting down, all ready to go, waiting for me. So I would have to numb one patient, go to the other one, start trimming their denture. Once I'm done with that, I go do cleaning. And by that time, they're probably 10, 15 minutes past their anesthesia, totally ready to go to do the filling. So I do the filling, and then I go to another room to numb up a patient to take out their tooth. So it's really different in real life than in dental school because here's their schedule, here's what you're supposed to do, but do things ever go according to plan? No, they don't. So you end up being pushed back, and you end up having like patients that could be angry or upset. But thankfully, my patient population is very appreciative, and that takes off a lot more stress that I could have. So yeah, there's a lot of thinking on your feet because when emergency patients come in, you have to think on your feet about what you should do for them right away in the midst of you taking care of other patients, because sometimes they have some big swellings that need immediate treatment. So yeah, I'll let you know about some cases like that. And then, yeah, so the difference between dental school and practice is that you're a student and you're all of a sudden a doctor. Not all of a sudden, because you train all your life for it, but you don't know everything because you only did 4 years of school. It's not the same as practice. So sometimes I don't know things and present the treatment options to the patient, and I say this might work, but this might not work. So, I mean, what are you leaning towards? And they just say, whatever you think. You're the doctor. I'm like, I trust you. And then sometimes I don't know what the best treatment option is. I'm giving you these treatment options, but sometimes it's a collaborative effort with the patient to figure out the best thing for them. All right, so I work at a federally qualified health center. Here's the definition of it. It's a community-based healthcare clinic that receives funds from the HRSA, Health Resources and Service Administration, to provide healthcare in underserved areas. And these FQHCs must meet stringent set of requirements. So they have to have a certain amount of patients, be able to help patients if they're not able to pay. So a lot of patients come in and they don't have insurance at all. So there's something called a sliding fee. So if you can't afford treatment, the price of the treatment will basically match your income, so you are able to afford it. Nice thing about working at these type of clinics is that you're eligible for scholarships, full ride scholarships, loan repayment. If you don't get the scholarships, that's what I'm doing right now. I just applied and got it. And it's salary based. So instead of what the most of the dentistry world is production based. Kind of like a hair salon. You go to a hair salon and you get whatever you want done for your hair, and that's what you get paid. You're not paid an entire year on a certain salary. If you see a lot of clients in your hair salon, then you'll get a lot more pay. So that's the same thing in dentistry usually, where if you do more advanced treatment, if you do treatment faster, if you do more patients in a day, you'll get paid more. But at FQHC, you are salary based. So if patients don't show up, you still get paid. If a lot of more patients show up, you still get paid the same amount. You don't get, well, at my place, I get bonuses if I see past 16. But yeah, the gist of it is that you're salary based. All right, so I'm going to talk a little bit about this, and then we'll lead into the cases. So dentistry's role in medicine is that we see patients more often than physicians, because first of all, we see patients twice a year, every 6 months, and then they usually need cleanings, they need fillings. So we just see them pretty often, and we have to build a relationship with them. And because of that, we can catch things before they become even a bigger problem. When patients come in during the comprehensive exam, we're always taking a look at their face, feeling their face and neck, feeling for any bumps, abnormalities, and stuff like that, because these things actually can tell you more about the rest of the body, like palpating the lymph nodes, the thyroid, and then the face. All right, so let's start with case study 1. All right, so the chief concern, which is CC, patient mentions that she feels discomfort and pain when she's turning her neck towards the right. Explains it's been present for years and expresses that it's uncomfortable but not unbearable. Objective is she's a 46-year-old female, presents for periodic exam. So after the soft tissue examination, it's within normal limits. The mucosa is within normal limits. The TMJ and occlusion is within normal limits, which is open and close. The caries risk is high. Caries is cavity. So we always characterize patients by their risk for cavities, and risk goes up if you have fillings. If you look at this x-ray over here, she is missing all her back teeth. So the caries risk is really high. There's a reason why all those teeth are gone. They had cavities and they had to be taken out. So, okay, lymphadenopathy is the lymph nodes. There's no problems with the lymph nodes. And that's something I was trying to look at, because if she's turning left and right, it could be something in her neck. So assessment. I think I know what's going on. So I'm going to take a panoramic radiograph, which is this x-ray right here. So I see something right on both sides, actually. And it's actually, let's go back. Right here is the stylohyoid ligament, which is a ligament connecting from the bone, the skull, to the front of the throat right here. And she said she turns right and she feels it. So this was textbook from dental school, where this thing right here is longer than it should be. So it should be right here, but this entire ligament got calcified. So that's why when she's turning left and she's turning right, one side more than the other, she's feeling some kind of discomfort. So how do you treat that? You refer to oral surgeon, and you either, remove that area with surgery, or you have to deal with it by just taking pain medication. So that's what we did. We sent her to oral surgery, and then they take care of it from there. All right. So case study 2, I had a patient come in. 56-year-old patient has tenderness when eating. Patient informs us that number 32 root tips have been left behind from after previous extraction. That's over here. But I didn't see anything over there. So her medical history, he's taking lisinopril, hydrochlorothiazide, Januvia, pravastatin, aspirin, and loratadine. Excuse me. So with your practice, you become, you're gonna get really familiar with all the drugs and the common drugs that people take for their certain diseases. So right at the bat, this person has hypertension for lisinopril. That means high blood pressure. She's also taken this for high blood pressure. Januvia is for diabetes. Pravastatin is for high cholesterol. Aspirin is also for high blood pressure. It's a blood thinner. And loratadine is for is GERD, which is gastrointestinal reflux disease. And when we see these patients, we are trying to classify them according to the ASA classification right here, which is from the American Society of Anesthesiologists, how they classify patients and how medically compromised they are. So because this patient has diabetes, hypertension, but it's well controlled, she's not ASA 1, which is healthy patient. She's ASA 2 because it's not severely compromising her daily life, which is ASA 3. As it goes higher and higher, that's when you start to become more and more careful. I want to say careful because you should always be careful, but more cognizant of the type of treatment you're going to do, what kind of effect it will have on the entire body. Because sometimes if you're just doing normal filling, you're also using the local anesthesia, and local anesthesia has epinephrine in it, and that raises blood pressure. So if the blood pressure is really high, you don't want to aggravate it some more, because getting tooth extraction, that's a stressful situation. Your body reacts by pumping more blood. So if you add more epinephrine, you add a bunch more things and add their medical history, you can have a heart attack. You can have something that happens that you did not want to happen. All right. So I took another panoramic to figure out what's going on when she has tenderness when eating. So what I did was, like I do at every exam, I'm palpating all the lymph nodes, going inside the mouth and touching everything. And when I went inside her mouth and touched the floor of her mouth right here by pressing outside of her neck right here, and then pressing inside the floor of her mouth, she felt some tenderness. So that kind of made me think that, okay, something could be going on with the salivary glands over there. And she said she has tenderness when she eats. And when you eat, you salivate. So that's what I thought was going on. And then I took the x-ray like over there, and I see what's going on right away. Exactly what I thought. It's hard to see, but because you're trained to see it, it's those white little dots right there. This is a panoramic radiograph. So the scanner goes around you and scans to create a 2D image. So it applies the image where it is right there. So the gland is right here, and there's calcifications in it. So when she's salivating, when she's eating, she feels tenderness because those ducts that secrete saliva are being blocked. So that's a problem. So what I did was, do I have the, well, I don't have the answer here. So what I did was I prescribed her pilocarpine, which is a sialagogue, which means it stimulates the patient to salivate a little bit more. So I gave it to her to use for a couple weeks and told her to come back in a bit to check if those ducts were unclogged. So she came back and those ducts were unclogged and she felt no pain on tenderness when I was pushing around, and she felt a lot better and she could eat happily now. So yeah, there's that case right there. So let's talk about case study 3, which is actually what you see a lot in this clinic at federally qualified health centers, because these are a lot of the emergencies that come in. So patient shows up. That's not the patient, but pretty textbook about what my patients usually come in with. Not that big though, but he came in with a swelling on the left side. 50-year-old male patient reports pain with facial swelling that's been a problem for a few days. Patient was unable to sleep last night because of the pain. Patient reports no fever or malaise. That's really important, because if he has fever or malaise, that means it's even worse, and it's in his systemic system that he will need more aggressive treatment. So the objective statistics is, from my extraoral exam, you see visible swelling in the lower left region, indurated to the touch. That means it was hard to the touch. Radiographic exam, taking x-rays, I see occlusal caries, which is cavities from the top, and apical periodontitis. So that's at the bottom of the tooth root, there is bone that's missing. Intraoral exam shows occlusal caries of number 19, mobility of number 19, and swelling of the buccal vestibular space. So the tooth, it was moving, and next to that tooth is the swelling, also inside. So he's swelling outside, he's swelling inside. So if you look on the picture on the left right here, this is not the molar, but this is a premolar, but same idea. So what happened in his case is there's an infection in the tooth, and that infection is growing. So it needs somewhere to go. It will go out the path of least resistance. It's not going to go out the top because the tooth is intact. It won't go out that way. It will go out down where there's spongy bone. So it's going to go out here. So that's the periodontitis. That's a periodontitis that I saw on the x-ray, which is like a dark circle. But over time, if you don't treat it enough, or get in there and treat it, it will go again towards the path of least resistance. Isn't it going to keep going and going until it breaks through the bone? And after it breaks through the bone, it will go through the next path, which is the cheek over there. Now, the danger of the swelling will depend on where it is. There's a muscle right here, and this swelling came out above the muscle. If it was underneath the muscle, it would be invading a more dangerous space right here, underneath the tongue area. And that's more dangerous because it's going to start swelling the tongue, and it's going to clog the airway. So the patient won't be able to breathe. So if you don't treat it, it's going to get bigger and bigger. And if they can't breathe, that's going to create a huge lack of oxygen to the rest of the body. And if the infection spreads to the rest of the body, then things are not going to look pretty. So the plan is to take the tooth out, because we can't save it. We'll need to take the tooth out. If we could save it, then what we would do is we would make a hole through the tooth and then push all that pus out. And then antibiotics afterwards. So that's what we did. And I will show you what it's like to take out a tooth like this. So before we do that, let's talk about extraction concepts. So when people say you take out teeth or pull teeth, you're not really pulling teeth at all. It's actually, you're finessing it out of the socket. Like the previous presenter, Dr. Ruby, said, it's all about technique. It's not about force. You're not supposed to push really hard and like break the freaking jaw, because you don't want that to happen. When you first start in dental school, everybody's just like standing and just pushing really hard, but you don't have to do that at all. You just wiggle it out. Okay, so extraction concepts, it's all about physics. If you understand what it looks like in the socket, it will come out a lot easier. And to know that, you have to understand the entire jaw anatomy, where it's dense, where it's more spongy, what the tooth roots look like, because there are many times where it may look like that on the x-ray, but then when you take it out, it's another story. And I have a case like that next. So I have the pictures of the steps you do. So what you want to do is elevate the tooth. So that screwdriver looking thing, you're sticking it right into the bone and the tooth. A lot of people, when they first learn about oral surgery in school, they just think you're just putting on the gum and they're just wiggling like this. It's not going anywhere. You're just screwing the gums. So what you're trying to do is, where this beak is, you're shoving that instrument right into the tooth and next to the bone. It's kind of like if you were trying to, I'm trying to find a good analogy. Okay, so there's a mailbox post in your front yard and you're trying to stick your shovel to take out that entire mailbox in one sitting. So what you're going to do is put that shovel right next to where the post is and where your grass is, and you're going all the way down, and you're creating leverage against the dirt that you have next to the post, and you're just wiggling it up and down. So what that's going to do is, just like this in the picture, creating space next to the tooth and moving it up. That's what elevation is. Another thing you can do afterwards is apical pressure. So apically means towards the root of the tooth. So you're putting pressure into the tooth, and that creates more room down here. Lastly, you're gonna move it back and forth a little bit. So that's buccolingual expansion. So the tooth is gonna go right, left, and what that's gonna do is move the bone a little bit and expand it a little bit. So now all over the socket where the tooth is, there's enough wiggle room. When you see blood coming out of the socket, that's a good sign, because you've created room. So, okay, now this patient came in for the swelling, and there's a tooth right here on the left, and I needed to take the tooth out because one, it's a wisdom tooth, so it has no use. And I have to take the top one out too. And it's causing an issue. So I took it out. So what you have to do first is understand the anatomy and understand what you're going to do. Can I move this back real quick? Let's escape. All right. Let's move this over here. Present. All right. It didn't show up. Let me back up. Control Z, Control Z. Okay. I'm gonna do it this way. So you see this highlighted yellow here? That's where the nerve canal for all your lower teeth is for one side. And wisdom teeth, they tend to be right next to it. And this tooth, it was right next to it. I could send it to the oral surgeon, but sometimes they do not have the space for it, and then it can swell up. So it's a balance about knowing your limits and knowing what you can do, and working with the other doctors in your community. So what you have to do first is do an incision, so that you're cutting the gums. So this is what I did right here. I cut the gums in the back, and then I moved the incision forward. And you never, ever, ever, ever want to cut diagonally towards the tongue, because your lingual nerve is there. If you sever that, they won't have sensation to their tongue, and that sometimes cannot heal. nerves can heal, but they will take very, very long time. Why? Because there's no vasculature to them. There's no blood supply to the nerves, but there's surrounding blood, but there's no direct supply to the nerves. So that's why it takes so long to heal. So you have to be very, very careful. So the next thing you do is flapping. So that's taking an instrument and removing the gums and the underlying periosteum, which is the layer between the bone and your tissue, and you're reflecting that back. You're peeling it back, and it's a lot harder than it looks. And then now you have access to it. And your design will be based on how much access you need. I try to be conservative, but you want to have enough so that you don't tear the gums. It's better to make a nice clean incision than to go in there and start like messing everything up, because your patient won't heal as fast if you cause too much damage to it. And plus, if they're longer, they sit longer in your chair and their bone and their gingiva is exposed more, then it will take longer to heal. And you just want to go in there with a plan and get it out. So the first thing I did was create room to see the tooth, and then I cut the tooth in half right here. So I cut it buccolingually. That means looking from the side, I'm going to cut it right through so that it goes right through the furcation, which is the roots. So if I go right through the tooth, that means I create two nice pieces that I can wiggle off on their own. So there's the back piece. I was able to get out pretty easily, but the front, usually when I cut straight through, it will come out really easily, because in theory, yeah, you have two root pieces that now have plenty of room to go out. But that wasn't the case. The front, the mesial root was stuck there, and it was super hard to get out. What happened was, when I got everything out after multiple pieces of cutting, I found out that the mesial root, the front root, was actually curved, but it wasn't curved in a way that I could easily see it. It was curved in the direction of the way I'm facing the X-ray. So that's how they scanned it, and that's how it came to be. You can see it right here. So here's the shadow of the root right there, and then the curvature of the root is right here. That little bulb, it was facing directly at me. So that's exactly what I saw when I went in there and wondered why it didn't come out. It's because of that little curvature that I couldn't see. Now, if you had a 3D X-ray, which is called a CBCT, you'd be able to produce the image real time, and then you can just rotate it back and forth all the way around, so you can see the dimensions of the tooth. But people, you don't usually do that for a daily basis, but they sometimes do that for taking out wisdom teeth. But not everybody has that machine. So you can see how dentistry and technology can vary and give you different results. All right, well, that ends my cases. So I'm gonna start talking about tips and advice for studying, because to get to this point, you're gonna have to have good grades, and to have good grades, you're gonna have to have some good study habits. So what I realized in undergrad was that I was spending a lot of time studying, but not necessarily getting the results I would get from putting in the time and effort into studying. There's got to be a better way. There's got to be a faster way. There's got to be a more efficient way. So literally what I did, I was a wee freshman, a wee sophomore, and I was like, after my first C, I was like, oh crap, I don't know how to study. So I looked up how to study like a medical student. And I swear every medical student uses this. It's called, it's called Anki. It's right here. This program you will definitely need if you want to make huge gains in your studies. So how that works is it's based on the forgetting curve. So look at this graph. X-axis is the amount of days or time in general, and then the y-axis is retention. So as the days go on, you will forget certain things. Say like yesterday, you remember what you did, what you ate for dinner, or what videos you watched on YouTube yesterday. But ask you from a week from now, you probably won't remember everything. That's how the forgetting curve works. Now, Inky, the study program, is flashcards that you make on your own, or you could download them from previous medical students, previous classmates that had made them. And what it does, it will show you those flashcards based on how you answer them. Did you click easy, kind of know it, or you do know it? It will show you the cards that you don't know until you start clicking, you kind of know it. And then until you finally click, I know it. It will still show you the ones you know, but it will basically reinforce everything so that over time, you will have high percentage of memory retention. And that has been amazing. I use it all of undergrad once I figured it out. Undergrad and master's program. I use it strictly in master's program and dental school. So it helped so much. It's basically a cheat way to study. So this is what it looks like on the right. So you make your own flashcards, and then you can also put your own diagrams, really customize it. It takes a lot of work, but it really helps. So consistency is key, just like exercising. You want to dedicate a few hours each day, as long as you just do it and keep up with your routine, it would become a lot easier. So that goes hand in hand with the Inky system, because if you have a goal of studying 50 cards a day, by the end of the week, you should be all set and ready for your midterm. When I was studying for my DAT, I watched motivational videos every single morning. It was not giving up on your dream, working super hard, like what is your number one goal in life? I would watch Rocky Balboa, all these things to get me pumped up. And yeah, I was pumped up to study. But lastly, you got to remember, with all your hard work, you want to stop and smell the roses. Life goes by super fast. In a blink of an eye, you'll just see that you're in dental school, and another blink of an eye, you're going to be a dentist, and then another blink of an eye, you're going to have kids, and then you're going to have a car, a house, and then all these things. But you got to remember that life is more than what you are aiming for. It's not the end point you're trying to get to. It's all about the journey and the people you meet and the things you learn along the way, because that's what makes up life. And that's what you want to remember, even if you choose to do dentistry or not, because that's what it's about, being on this earth. So yeah, that is my last thing. Oh, actually, second last thing. All right, I just want to end up with talking about my predental services I do for predental students. I do personal statement review, test, application review, and dress mock interview analysis. So my website is dentistrywithsteven.com. I'm making it affordable for you guys, because I know you guys are already paying, a lot for applications. So this is a service to you guys that I want to keep continuing. And I love it when you guys get in and message me about what schools you've gone into. And yeah, so down there is a list of students that have gotten accepted from the mock interview and personal statement review services. So as you can see, it's all different schools across the country. So yeah, reach out to me if you guys want that. All right, I am all done. Thank you for listening to my spiel, and appreciate your time. Let me know if you guys have any questions.
All right. Thank you, Dr. Liu. That was awesome. So I think we can start with our questions now from the YouTube live chat and
Awesome.
Instagram. We have some time left. So okay. Our first question was. So when or were you asked about your GPA, your 3.55 GPA during your interviews?
Um, in what sense? Like if it was high or if it was low? They didn't ask me about my grades at all, actually. Um, because at the interview stage, you're pretty much an even playing field with everyone else. And when you get an interview, that means they've already understood that you're capable of dental school. So they want to meet you in person and you get to know your personality. So they never asked about my grades. Say if you got multiple C's, they would probably ask you that, or if you failed the class, they would probably ask you that. But you answer it by being completely honest what happened during that time. Most importantly, you should have grown from that and learned something from it, and be able to explain that it was experience that you learned from.
It sounds good. And then somebody else asked how difficult it was to find a job after dental school. So you mentioned that you were at a community health clinic. So I guess how did you decide to do that? And what was that process like?
Good question. I was actually open to all sorts of employment, like private offices, federally qualified health center, um, corporate. So I interviewed at corporate and federally qualified health centers, and I actually applied to some private offices. But applying for private offices is a little different. It's not as simple as like going in Indeed and putting your applications out. It's more of like networking. A lot of my classmates, what they did was they dressed up. They had their they had their resume in hand, and they would just walk into the office, introduce themselves, and say, "Hey, if you got any time, I understand Dr. So and so is super busy, but if I could, meet him for a few minutes, I am looking for a job. I'm a recent graduate. I would appreciate his time if he has any. If not, I can always come back next time." That way is a really good way because dentists are very, very busy people, and as you know, like things don't go according to plan. So doing something like that shows that you really care about them, and it would just look good to them if you did something like that. For me, it wasn't too hard finding a job because when you have the DDS degree, anybody wants you as a dentist, especially corporate offices. Uh, they they try to get a lot of recent graduates. Private offices, their reputation is on the line, so they want to do more searching. They want you to be more seasoned. They want you to know more instead of spending their time to teach you, because anytime that they are teaching you, they're not producing as well. So if you find a good mentor that's willing to teach you, you should take that as an extra income, because even if you're getting paid less, the education and the mentorship you're getting can really make up for the amount of money you're lacking. It really depends on what kind of experience you're looking for. But yeah, so for my job, they actually reached out to me when I posted my profile on the HRSA website. One of the recruiters reached out to me, and we just got to interviewing it, and I took it because it was a great offer, and it was a great experience because it's a lot of autonomy. So yeah.
Okay, sounds good. So our next question is, do you have any regrets during your dental journey?
Oh my God, I was literally talking to my girlfriend about this today, and also thinking about this last week and a half, because I was just joking. I don't know if all you guys follow me on Instagram. I've been feeling pretty burnt out because I've been seeing 20-ish patients a day, and when I posted that on Instagram, a lot of my fellow dentists have messaged me in support that a lot of us go through that and get burnt out, and we were supporting each other, and a lot of people have felt the same way I do, and I started to think that dentistry was like a job. I go there and I do the work and I go home and I get paid. I still think it's super rewarding, but I think when you see so many patients, it starts to bog you down. And I can only imagine. I can't even imagine when my peers, my colleagues, when they have to hustle, because when you get paid for what you see, then that's a different kind of stressor. For me, I don't have to worry about if patients show up or not. Um, in the other world where it's production based, you have to think about how you present yourself to the patient. So if you think you said something wrong or said it in the not so nicest way, or you thought you said something nice and the patient might have taken it differently, that's probably something you can't ignore, because that the patient may not come back, or the patient may talk bad about you, and that's something you have to think about, because that in turn affects your reputation, also affects who comes back to your practice, and that's something you have to constantly think about. Another thing about dentistry is that it's very expensive. I would be a lot less stressed if I didn't have dental school loans, because then I could just walk away and take a break for once in a while. But because there's loans, and it's very, very, very expensive in that case, that a lot of someone's paycheck can just go to loans, and that can make life just be living like a student for 10 years. There's other ways to pay, just like paying 10% of your income, and then whatever starts to grow and grow and grow, you get taxed on that in the future. But yeah, there's different ways to do it. But another thing is dentistry is very, very hard on your body. I didn't feel any of that in dental school because I only saw 2 patients a day. Even though I'm sitting there for 3 hours, I still have plenty of time to just stretch and not really feel anything. But because I'm hopping from cubicle to cubicle and from patient to patient, I sometimes had to bend my neck in positions that aren't necessarily the most comfortable. And over time, that adds up to a lot of strain on your body that you wouldn't think it would, and creates a lot of pain. And these little things can start to add up. Like I remember when I go into clinic and then I see like a suction drop to the floor, or if I stand up, I hit the overhead light, and then the patient can't bend over, and patient can't open wide enough, and then I can't cut where I need to cut, and then the saliva just gets all over the tooth. And these are little things in dentistry that you don't really know that annoys you until you're in dentistry. And also, general dentistry is very hard because you're the front line for the patient. You are the gatekeeper for further treatment, like to specialties and stuff. So you actually have to know a lot about dentistry as a whole, because you have to know what treatment options are available to the patient and what is reasonable for the patient. So you're constantly thinking on your feet. You have to know a lot. You're working in a very small space. So if you're not good with your hands, if you get annoyed very easily, if you're not patient, dentistry might not be for you. And if you don't like talking to people, unfortunately, teeth are attached to people. So if you don't like people, then dentistry is definitely not for you. Unless you do more schooling and do oral surgery when they could be asleep, you don't have to talk to patients as much. That can be something else. But hey, you still need to talk to people to get the interview, to get in dental school, and talk to your patients in dental school, and then to graduate. So yeah, dentistry is hard, and it's not sunshine and rainbows that we tend to post about as dental students on Instagram, because yeah, it's not all sunshine and rainbows. You got to really love it to make it worth it. And I was really looking forward to presenting you to you guys, because it's a little break from my daily routine. But I also want to be real to you guys about dentistry. And that was a great question because a lot of us, the new 2020 graduates and dentists in general, it's it's very stressing on the body. Some of my colleagues would say, like, I wish I could go back and go to specialize in ortho, because as an orthodontist, you don't do as much as the work. Your orthodontic assistants do a lot of the work. So they're putting on the brackets, they're removing the brackets, putting on the wires, and you're just looking in there, okay, and then you just chill. So it's super nice. I remember, if you guys follow the Bentist, like THABENTIST, he's an orthodontist and a streamer and an Instagrammer, TikToker. He was talking about how one of the people that was on his stream was asking him if you want to be a general dentist, and he was like, hell no, because it's stressful. Like, you're constantly in people's mouths and bending over and doing very stressful work. As an orthodontist, he doesn't have to do that. So each specialty has in dentistry has its own pros and cons. For me, I chose general dentistry because I wanted to meet all types of people. I wanted to meet kids. I wanted to meet older people. I also wanted to do everything I could. But yeah.
Okay, thank you so much, Dr. Liu. Those were all the questions we had. And yeah, we really appreciate your time and all your responses.
Awesome. Thank you. Yeah, if you guys need any help, any opinions on things, reach out to me through my email or my Instagram. So yeah, thank you. I'll see you guys.